Good evening, good afternoon, and good morning. This is the 902nd day of the continuous webinar conducted by International Forum for Promoting Homeopathy. As you know, today we celebrated our first family meeting at Cochin, and it was really a fantastic one. So let us begin the session with 1 minute silent prayer. Thank you all. As you all know, today we celebrated the first family meeting conducted by International Forum for Promoting Homeopathy. It was really a big event, and doctors from a different part of Kerala, and particularly another exception was Dr. Nagendran from Kanyakumari, from Tamil Nadu district, also was there. Joined us, and everything began exactly at 9 p.m. itself, but the official function began only by about 10:30 because we were expecting a lot of guests. They were on the way due to some interference in the traveling system. And anyway, it was went in a beautiful way. There is no interruption in between. There was music in between, and our doctors were able to sing some of the song in the beginning session. And the morning session is Dr. Nanda Kumar, Dr. Mohan Kumar, Dr. Dr. Unnivali, and so many doctors sang song for us, and that really an encouraging one. And our guest has joined now, and there was a distribution of honoring our doctors who are above 70, and suppose Dr. Hariharan and Dr. Sridhara Kurup, and all were supposed to be there to receive them, but we will arrange all those things in the future because due to some technical our family problems, they were not able to attend. Anyway, it is nothing to do with that. We will be giving all respect to these legend homeopaths here. And the function was really an exciting one. There was a live commentary, a live description through the Facebook page, and some of our doctors suggested it was very, very good. Reported back to us that it was a really an entertaining session, and it's really an encouraging session, and IFPH is really a wonder to those people who are looking from outside the world also. And let us go to today's program. Today we have a wonderful guest in Dr. Paul Joseph. He is a man in all with a lot of abilities, and he is saying he's really a doctor from Sri Lanka, now resides in Canada and practicing homeopathy. He studied a lot homeopathy in Kerala, India, particularly in Tamil Nadu district, and he's really a beautiful person, having very good expertise in homeopathy. And let me introduce Professor Dr. Paul Joseph, BHMS, and RHOM Canada, and PG diploma holder in acupuncture. Practicing in Toronto, former professor in homeopathic medical colleges under Tamil Nadu MGR University, India. Author and writer of various medical articles and published 2 Tamil books on health, and he has written so many poems also. He is a radio host during talk shows on health and politics in Geetavani for 15 years, doing talk show on health in TED TV 10 years in Canada. That is something great because a man from India, from outside Canada, is doing a wonderful work in Canadian television. And today, as you know, the subject is learn to be learned. He has shown how beautifully what to be learned and how to be learned and what is to be learned for the future. So it is the second part of the same is about to begin. We are proudly welcoming Dr. Paul Joseph for this session, and Dr. Hariharan will be moderating from the other end to the next part of the session. We are proudly to welcome to you to the 902nd day of these continuous webinars, sir. Welcome. Yes, please unmute, doctor.
Yeah, good morning to all. Is it audible?
Yes.
Oh, all right, that's good.
1 minute, 1 minute. You are not made co-host, I think.
Yeah, you have to, because I have to share my
Yes,
screen.
yes. Dr. Baburaj, please make Dr. Paul Joseph as the co-host, as secretary. Please look into this matter. Of course, you can start talking, and then we can begin with the slideshow.
Okay.
Once, okay.
Okay. So first of all, I thank you all for giving me an opportunity to talk in the international forum. And yesterday I saw until Canadian time noon, the midnight 2 o'clock. So everyone, I think you were enjoyed the family meet. Really, the organizers, especially the Dr. Saji and Manoj and Ganesh and the other the senior doctors, those who are participated in the family meet. Really, it was wonderful. And during the introduction, you said a lot of things about me. I accept it, except you said he is a beautiful person. No, I'm not a beautiful person.
It is not like that. You are really a beautiful person. There is.
That's okay. That's okay. Okay. So today I'm going to start with a song. It's one of the.
Please, please, you are muted, doctor. Please unmute once again. Okay.
What about the screen sharing?
It is not up to ready. It is not yet to ready. Not yet ready because I'm not the host, and somebody from other end is hosting the session. I will just ask him to do that. You may continue with your talking, or you can sing the song, sir, for the time being.
No. It's a song I have to play. That's why in the video.
Well, you just talk for some time, so that I shall contact him by phone and ask you to make.
So in the last class, we were discussing about a lot of things. Learn to be learned. So apart from what we learned in the past through the medical school and through our experience, through our senior doctors, through our the teachers, so a lot of things we learn. And also we learn from our masters like Kent, the other, the Hanneman, and from their textbook. A lot of things we learned. But when you apply on the patients, so in many conditions, there are a lot of problem when you're facing the patient face to face. While case taking, there are a lot of problem, but we are facing at present. It is okay? Now it is okay, I think. Dr. Danesh?
You will, yes, yes. Now I can make you. Now I can make you. Okay. Okay.
Is it?
Now it is your co-host now.
Now it is okay. Okay. So what I'm going to talk, the hidden part of the case taking when we face difficulties. So we have to use, or we have to have a different technique or different technology to obtain the case, or to unlock the patient, to get the clear picture from the patient. So in the last session, we talk about a lot of things, and I think the concept of iceberg of concept, what we learned is a small part to be learned. That is very important. There are 1/8 of the portion which is submerged. So we have to unlock, we have to take out the patient from the submerged portion. So that's why last class, I think, so how to reveal the picture, the real picture of the patient. Those things we discussed, and how to unlock the patient. For that, I'm using different technique. One of the technique is using sensation acid. I think all of you know about this book, right? Sensation acid. So how to use it? Sensation acid is not a repertory. Don't think it's as a repertory. It is a tool to unlock the case, unlock the patient. And in the last class, we discussed about the key. So in the key to unlock the patient, we have already know the location, sensation, modality, causation, concomitant. From that, we must have the total, the full case taking. So without full case taking, so we can't come to the conclusion. But within the case taking, to obtain the PQRS, the characteristic, sometimes we need this technique, the sensation technique. The sensation technique, sensation acid technique, it will help to confirm the case, or sometimes it will help to enhance the constitutional remedy. If it is not the constitutional remedy, so already we have given the constitutional remedy according to the totality as per the repertorization. But when you give the intercurrent remedy through the find out from the sensation acid technology, so it will enhance the healing process. So last time we were discussed a lot of things, and right, I'm going to start with the case. Okay. So this is the case of psoriasis, came to me. I took a complete case taking, but I'm going to describe briefly here. It's a 4 years duration. All over the body, the lesions, the associated with severe itching, sleep disturb, and the patient, the desire, pickle and sour taste, modality, aggravation, warm, amelioration by cold, and the mind. When you go into the mind, so the patient has a history of grief. His close friend died by gunshot in front of him. This was happened a few years ago. And after that, the relationship failure with the girlfriend, hurt and humiliations, wants to be alone. Often the patient think and cry about the incident that happened in the past, like the friend died and the relationship break, all these things. So he always asking why it's happened to me. So like that. So in such a condition, he came to me on September 2016. So I did the full case taking and repertorization. Natamur came. So I prescribed Natamur 200 weekly dose with the placebo for 3 months. So in between, I prescribe as an intercurrent remedy thyroidinum 200. So why I give thyroidinum 200 as an intercurrent remedy? Because the patient has a history of family history of all the members in the family. They have, especially the female, they have hypothyroidism problem. So I gave few doses of thyroidinum 200 and with a placebo for 3 months, not continuously. So this thyroidinum technique I learned from my master, my teacher, Dr. RSP. I think many of you know about him, the Dr. RS Pandian from Madurai. So he insists me, and he in his technique, whenever the patient come with the thyroid history, they must have history of shock or history of grief. So better you consider with the thyroid. So I refer the Materia Medica, the Court of Appeal. in the Padak Materia Medica, always I have in front of my the table, consulting table, because that is one of the things to analyze the already repertorized cases to confirm with the Materia Medica. So skin is very dry, psoriasis and peeling of lower limb symmetrically appear. The lesions are symmetrically appear bilateral. So then I gave some external application. The castor oil. Castor oil is one of the, in Tamil we call Amanakennai. I don't know in Malayalam, the castor oil. And I gave some supplement too to promote the healing. Vitamin D3, 2000 IU, like that. Then the follow-up, after a few months, they improved only 50%. There's no itching, feels better. Patient started going back to the work and the part-time study. He is interested in cataract technology. So he started doing all this, he back to little normal, but it's 50% only. Then the next visit, 2017, October, the patient came and I asked him, so what kind of sensation you feel under the psoriasis lesion, the patches, psoriasis patches. So he just explained in such a way, feeling of losing muscles in leg where the area affected, particularly where the area affected. So immediately I referred H.A. Robert, sensation as if loosened from bone and flesh wear. So again, I refer the other rubrics in the sensation as if it also mentioned the lycopodium and sulfur. You know, lycopodium and sulfur are the, right, according to the Rajan Shankaran in Soul of Remedy, he mentioned is a vegetable sulfur. Lycopodium is nothing but is a vegetable sulfur. So sometimes we have to differentiate the plant remedy and the animal remedy and the mineral remedy. So in such a way, so we must have a knowledge when this kind of confusion comes. So lycopodium, sulfur, or lactases, whatever, the plant remedy, animal remedy, and the mineral remedy. So if it is these remedies come close together, then we have to go for the analysis of the kingdom classification. So everyone must have the knowledge based on the kingdom classification. So that will help to understand or select the suitable remedy in such a way. So in this case, I refer again the Patak Materia Medica, because lycopodium patients are intellectually keen, but physically they are, muscularly, physically there are loss of power. And in the Materia Medica, psoriasis is also mentioned. The lycopodium patient, everyone knows that building strong, but the basement weak. So I gave lycopodium 200 every other day for 1 month. Then after that, you can see so almost 90% gone. There are small patches over here and some scars are there. So completely, so after that, after a few months, completely is gone. So this is the way just I, using my technique, the methodology. Then the next, the other case, the beyond the totality. What we are going to learn beyond the totality. A patient came, so she is a regular patient, visit to my clinic for various ailments, and in the past years, GERD, the gastroesophageal reflux disease, and UTI, urinary tract infection, then vertigo, leukorrhea. So in different periods, she came for the treatment. I treated successfully with the same ailments. And in March 2021, when the COVID starts, that time, the patient came with the difficulty in breathing, weeping, worried. And the patient says, someone they did a black magic on me. So with that, the patient get anxiety and panic. Took a history of, I took the history again, as usual, the full history. I asked her, explain about the breathing, because that is the main problem. So she said, on expiration, very, very clearly he explained, because already he trained, because the many years she came as a patient. So I trained her how to explain the things. So he explained, expiration feels severe spasm, the tube inside, because she doesn't know what kind of tube, what kind of organ is there. Organ is there inside. So he said there's a severe spasm in the tube inside the lung constantly. But the family doctors and the specialists, they confirm that there is no COPD, there is no asthma, there is no any obstruction in the respiratory tract. So I referred the another method. This is not the sensation method. I refer a repertory, homeopathic no-suit and Sarcot, homeopathic no-suits and Sarcots by Berkeley Square. This is the book. So this book introduced to me by Dr. Srinivasan. So in the rubric, there's a bronchi in the respiratory chapter, bronchi spasm of. So there's a pituitary came. I don't know why the pituitary came. So that is a very interesting. After that, by intuition, so I prescribed the pituitary 200. By intuition, I advised her to evaluate the pituitary gland with the concerned specialty. Just I explained him. Yes, you consult your family doctor and discuss with about that. So after that, the patient came in the month of March, I think. Sorry, March 1st. Then March 19th, they took a MRI. Did you see anything is there? There's a pituitary adenoma. See? So the MRI revealed the pituitary adenoma on March 19. I don't know how it came the picture. So now there's no symptom, nothing, but the patient waiting for another, because if any problem comes, then only they will take the MRI. Otherwise, they don't take. So the patient waiting for another evaluation. But there's no such a symptoms. Patient is she is perfect. Then another very interesting case of hemifacial spasm. Hemifacial spasm is a nervous disorder which the muscles of one side of the face which twist involuntary movement. So this is a picture of the patient. So continuously. So it's going like that. Okay. So you know the anatomy of facial nerve. I don't go into the detail, but here I learned the other technique, the pathology totality. How the pathology totality, pathology knowledge, the anatomy knowledge, which help to select the remedy. Say the impression from the pathology. I discovered the patient, the report, the MRI report says the tortuous eclectic basilar artery compress the left anterior aspect of the palm, including the route of entry of zone of the facial nerve. So there is a compression of the facial nerve. Because of the artery tortuous, it's a turn around the facial nerve. So this was happened. Now you can see the picture, clear picture of the circle of Willis, the basilar artery. Now you can see on the left side of the screen, there's the basilar artery and the seventh cranial nerve, facial nerve. See? So everything is there, the pathology. This is the anatomy and pathology knowledge. So clear picture. See how this is the facial nerve. Then the artery tortuous and turn around the basilar arteries turn around the the facial nerve. So I took the history. This is just for example, I am just showing some the repertory technique. This is not the full repetition, but for the teaching purpose, I took a few symptoms to show where the rubric is there, the related rubrics. There's the phase, complete respiratory phase, convulsion, spasm. Then the convulsion, spasm, excitement with the vascular lesions. So again, the gelsemium. So I refer the coat of appeal, as I said, the further materia medica, gelsemium. Now see the picture of the gelsemium. So there's the muscles and motor nerve, twisting of single muscles on the face. Again, the circulation becomes sluggish because of the compression of the artery, narrowing of the artery, the causing passive arterial venous congestion. Then the gelsemium indicate incoordination of the muscles again, which do not obey the will, because voluntarily it doesn't control of what the brain said, what the patient thinks. The patient is very orthodox. He is from orthodox religious background. Very difficult made to get the detailed history of mind symptom. Only the physical symptoms, because he doesn't want to reveal. That is the problem, right? There is a lot of variation. There is a lot of the comparison when you take the case from India and the Canada and Western countries. It's very difficult to open the nature of the patient, the total history of the patient. I'll tell you what is happened. Again, I refer the Allen Materia Medica, H.E. Allen's Materia Medica keynote. See what happened? The muscular coordination confused, muscle refused to obey the will. Then the Boger Materia Medica. Same. Then there's a word, ordeal. What is ordeal? Anticipation of any unusual ordeal. So this is very important. From here, then I start the conversation and interrogation with the patient. It's not conversation. Sometimes we have to do some interrogation. What is interrogation? Interrogation means it's not the simply case taking. The police, then the CID people, how they do, they interrogate the patient. So that kind of technique, sometimes we have to do it. Here, ordeal, the dictionary meaning, an ordeal is something difficult or painful, horrific experience the patient had. Then he started talking. So from that, the key, I opened the key, the patient started talking again. See, what is the history? His wife left him 3 years ago and living separately. He doesn't want to reveal the reason, even though the patient doesn't want to reveal the reason why it's happened, but he accepted. So that is one of the main things in our Asian community. But generally speaking, in South Asian community, especially in India and Sri Lanka, the separation of the family and the divorce and the breaking of failure in the relationship or love failure, it is a big issue for them. But in Canada, in Western country, no, we can't take the divorce or the love failure because it is here in the Western country, it is a common symptom. It is not the peculiar symptom. It is not PQRS because it's a commonality. So we can't describe, we can't rely on the particular symptoms. We can't rely on those kind of cases. So that is very difficult situation, right? What we are facing here. So again, so I prescribed gelsemium. Patient is all right, almost. Now, see. So after a few weeks, so this was happening. Okay, now, okay. The other case, that's also a very interesting case. The man, general man, age about 75, the urination, burning urination, so frequent and yellowish, sometimes it's mild coffee brown, that means somewhere it's bleeding. So hematuria on and off. It's a clot pieces like the material comes while passing. Involuntary urine using diaper, weak bladder, enlarged prostate, burning maturation, must strain while passing. So I asked her, is there what kind of feeling you have while passing? So he explained in such a way. I feel there is a narrow, right, when the urine comes, so it comes regularly in the bladder and it's stuck. There's a narrow, there's nothing like it, but it's passing. There's no obstruction, it's passing, but he feels that the urine passing through a narrow pathway. So there's a rubric in the H.A. Robert. So then the history of the patient. The patient was a Navy captain back home in Sri Lanka. He resigned the job because of the civil war. So after that, he feels a loss of power, right? Order and dominate. Everything was lost. Everything went away. So loss of power again. So I think most of you know what is the remedy came. Lack of confidence and after resign, indigestion, flatulency, much noise while passing, flatters and constipation, hemorrhoid treated by Western medicine. This hair sweet, coronary artery bypass done in 2017. So it's based on repertory, I gave lycopodium 30. Then after that, after a few months, then yes, I pass on into the 50 millisiemen potency along with the Sabals cerulata because of the prostate. Mother tincture. Patient was all right, not fully. Then I want to introduce a intercurrent remedy. So that's why I asked the patient, right? Again, I refer the repertory, the H.A. Robert, page 335, 335, it mentioned digitalis. Only single rubric remedy, sensation as if narrow in the middle of urethra. It is there. So I gave digitalis. Because the digitalis, again, you can see the coronary artery bypass is done. This is the patient report. 90% block. So immediately they did a bypass before coming to me. So you know how the digitalis how it acts. It's a retrospective analysis. Then the other patient, this patient recently came and what's the time? Time is okay? Okay. So again, another very interesting case. Hello? It is audible? Hello? It is audible? Anyone? Dr. Danish? Hello? Hello? Everybody's okay? Okay. Okay. So another case of interesting case. It is a known case of IBS, irritable bowel syndrome. So these are the symptoms, and I repertorize the pain and cramping of abdomen, stitching in nature, sometimes burning and smarting, flatulency with the pain aggravation after eating. So there are a lot of symptoms. But when I go to the mental symptom, the patient doesn't reveal the symptoms, because the family is very known to me. The boy's family is very known to me. They are very close family friends. So that is a problem. Hello? Hello? Dr. Hariharan?
Yes, sir. The only slight disturbance. No problem, sir. You
Okay,
continue.
okay.
Continue.
Okay. So that the constipation, and as usual, the complete history I took. But patient doesn't want to reveal the mental symptom. I told you the reason, because they are a very close family friend. So whenever you too close with the patient too much as a family, because here that is a problem. I don't know about India. India also, I think. Nowadays the people are very, very, right? They want to keep the confidentiality. They want to keep secretiveness. In Kentian time, Hahnemann time, Boric time, those days, in our parents and grandparents' time, they are very close to the doctors and they share everything. But nowadays, no. The culture is completely changed. So we have to use different technique to obtain that picture. So that's why I'm just shouting from the beginning, right? Yeah. They're here. The other symptoms also is there, but patient explained about some few dreams and all. But there is no mental symptom. So how I can prescribe? Then you see the sulfur. According to the repertorization, totality, sulfur caves, right? So here, see. Then I ask the leading questions. When you ask, right, sometimes we have to ask it is against the rule, but sometimes we have to break the rules to learn and understanding more about the patient. After interrogation, I found the following techniques. The following techniques, how I learned, how I came to know because of the last symptoms. You can see here, H.A. Robert, there's a symptom like the rolling of gas together as a ball, like a ball, right? Just in nearby the umbilicus. So patient says like that. So from that, I got the colocin. See, the second remedy is colocin, the second one. Then see, Just I want to confirm that why this the colosynth came into the picture. Then patient started talking. I asked him, hey, what happened to you in the past? It's about some few weeks ago. Then he just, there's a complete silence. Then after that, patient started talking. Don't tell to my parents. He said the first word, this thing don't discuss with my parents, doctor, please. Then he started talking. There are a lot of indignations, irritability, the vexation, offended, anger, silent sadness, restless and nervousness. See, so why it's happened? The ailments after argument with the CEO, the chief. He's one of the big the businessman working with some very big concern. So there are some problem. So this was happened in the workplace bad experience. And also during that time, he's a very good player, basketball player. So there's a quarrels with fighting with friends, very close, intimate friends. They are for the last 7-8 years from the university itself, they become a friend and they are very close. So there's a problem in that while playing basketball. So after that, aversion to friend. So everything is confirmed, right? It's like looks like a staphysagria. Staphysagria also the same pattern, but here the colosynth came in according to the repertory. So in Canada, now you can see ethics and guide says we can't treat the family friends. We can't treat the family members. When they are become close, so there's the rules over here for many healthcare field. Even we can't treat. I can't prescribe even homeopathic medicine to my kids, to my wife. I have to send the family members to other doctors. That is a rule over here. Why? Because the patient-doctor relationship in Hahnemannian time, I said the Kentian time is different. Our grandparent time is completely now it changed. In the community living, this is the problem what we are facing. Don't rely on, because you are with the patient only 40 minutes, 1 hour, maybe 1.5 hours, maybe half an hour. It's different. How you are relying on what the patient telling. Most of the time, the patient may hide a lot of things. Most of the time, they may hide the things and right. So that is the difficult. In the community living, everyone knows each other. We have close contact. We have close family meetings in the worship places, in the festival. We are meeting all frequently. That is the problem. So in the organon, we study about the rapport. What is rapport? A close, harmonious relationship with the relationship in which the people or group concerned understand each other, feeling and ideas, communicate well. But this is okay, but sometimes it won't. So that's why they find out different methodology for case-taking technique and evaluation. And also the other way, when we take a sibilimum, right? When you refer the materia medica, see in case of sulfur, there are 90 pages. In the hearing guiding symptom about sulfur, 90 pages are there. So how you are going to match? If it is 90, all the symptoms, are you expecting from the patient? No. That's why our masters, they very clearly explain PQRS. If the PQRS important symptom, characteristic symptom is fixed, then you can select the remedy. So like that, even you can later you can refer the aphorism 104 and the other aphorism 162 and 164. That is for you. So what I learned, what to be learned in the conversation will be the better in the patient own language. So whenever the patient comes, just be with the, right, talk with the local language, the patient language. Patient language means their own language, mother tongue. So it comes from heart to, right, that every thoughts come from the heart. The fluency and flow of symptom will be good. When you talk in a different language, so most of the patient, that's why most of the South Asian people, Indian people, and Sri Lankan people, Tamil speaking people, Malayalam speaking people come to me, because they easily they can express the symptom. When they go to the English doctor, there's a problem. Then they have to think in their own language and convert it into the English. So it's difficult, right? So that is in English, there are limited terminology. Be a master in the mother tongue, please, because mother tongue never lies. So case taking, be carefully about the story creators. Most of the patient, right, whenever they come, they create the story. This has happened 60%, 70%. The patient doesn't know the medical language, they doesn't know the homeopathic language. So that's also again, so we have to convert into patient language, convert it into the clinical language convert into the rubric language. So when you do a lot of translation, there were a lot of mistakes happen. There are chance of a lot of mistakes happen. So that's why better in social dialect. That's also very important. Local dialect. So now I'm going to play the video. I think everyone knows this. That is in Malayalam. Tamil also it is there, but I'm going to play in Malayalam.
Sir, the audio is not working.
Hello?
The audio is not working. Only video we can see.
So there's a song, I think you can play it, and Kartin Molly. That is a Malayalam song. In Tamil also is there. So this is one of the familiar songs. I don't know how to, sorry. Okay. The song starts like that. It's the language of the wind, sound or music. It's the language of the flowers, color or fragrance. It's the language of ocean, waves or form. So like that, the thing is going on, the song. In between, there's an important line the poet mentioned. If we understand the language of nature, we don't want the language of man. That is a very important thing. The other important thing, if we understand the language of the heart, the men no need the language, the complete silence. And the other things, it's also is there. Like you can understand the spoken words, you can't understand the silence. Like you can understand the spoken words, you can't understand the silence. Then there are another important, this is the highlights of the song. If the truth is silence, very important in case taking. If the truth is silence, tear, silence, tear and silence is become a language. See?
Time is
Hello?
Time is 8:45 nearing. So
Okay. In the heart where the desire lies, restless to become a language. Restless to become a language. So here, that is very important things, right? So we have to have a different tool. I'm going to finish it. We have to have different tools to understand the patient, the language or symptoms, right? So that's why I'm using different technique, not only the same technique. I have different technique to unlock the case. That is very important. So simply totality and all, that's okay. But nowadays, always don't rely on what the patient tells. And the other things, see,
Okay.
in the Wikipedia, even till now, today I took the picture, this picture, what it says. Homeopathy is a pseudoscience. In the Wikipedia, one of the familiar social media.
Sir, time is over. We can have the discussion. We want
Okay.
discussion for 15 minutes. A lot
Okay.
of participants desire to ask questions and confirm it. Okay. Your
Okay, no
classes-
problem. Okay, no problem. We'll start. Okay. There are some politics that just I want to talk. That's why maybe
Yes,
later
sir.
we'll talk about.
Sir, we can have another session as per your convenience later, sir.
Oh, no problem. Okay, sir. Any questions?
Sir, please close your screen sharing, sir.
Okay. Okay, now it's clear.
Okay. Your class is fine and fantastic, sir. See,
What?
your class is fine and fantastic. Sir, your approach is very, very correct. Different approach we can do in homeopathy. See, we can go rare, peculiar, uncommon. See, we can go by ailments due to, or the rubric, or the totality of the rubrics, or see, a lot of methods. See, all the methods, whatever it may be, it will reach the right.
Yeah.
Right, like a diamond. Diamond we are taking from, see, mud and all. When it cleans and cutting the exact color of the exactly the
Yeah, we have to shining and we have to do this. Right?
come and shine.
Yeah, that's true. Really,
that
Thank
is
you,
what
thank-
is homeopathy. By
Thank
hearing
you, sir.
in the story of a patient, we can simply hear it and note that only certain points.
Yeah,
Only certain points. And we will again clarify it. And we will smooth it and find out the exact remedy. See, what you said is Jelsinian is very, very correct. Very, very correct. This is a wonderful remedy for nervous system. So usually we are using for, see, fever and all here. But see, in grave cases of paralysis, we are
Yeah.
using homeopathy.
That's good. Yeah.
Homeopathic medicine, and the patient will be improved. See, another doctor, Reza Pavia. See, raised the hand. Please ask Reza Pavia to doctor your doubts. Sir, please unmute him.
Yeah, Reza, you have to unmute and ask the question.
Hello, sir. Thank you for your good session. I have a question about the case that you give him pituitary from which book you give?
Yeah, this is the repertory of homeopathic no-suit and sarcode.
From which homeopath, sir?
The author, Berkeley Square.
Excuse me, sir.
Berkeley, Berkeley, Berkeley Square.
Thank you. And which symptom the patient you take from patient this remedy?
Which one?
And which symptom you take from the patient?
Oh, that's why I told you there is in the repertory, it mentioned the symptom. Patients explain very clearly. There is a narrowing of tube when the patient expired. The narrowing of internal tube. Internal tube means the respiratory tract, right? So she feels that. She feels that particular sensation. So from that I took her.
Thank you, sir. Thank you.
Okay. Okay, thank you, sir. See, another, our dearest doctor, Dr. Ramadevi Ambadi, is like to ask questions. Okay, doctor, you can unmute. Please unmute.
Yesterday,
Can-
I think yesterday the announcer, who is the moderator of the program, he announced Amma of IFPH.
Amma
Right?
is Amma of IFPH.
yeah.
It was like really.
Okay. It is really correct. It is really correct. Now she is 76. I think she is the most aged lady doctor in our platform, and she is having a lot of experience. She is
really.
infertility.
Yeah.
And we are always saluting her. We are always profound knowledge regarding infertility. Profound knowledge.
Blessing. I need your blessing. That's why.
Okay.
Sir, there is one more lady doctor named Dr. Bhadrama. She is also very aged, same as I think.
Bhadrama.
She was a professor at Homeopathy Medical College, Botanical.
Namaste.
She is also there watching every day.
Doctor, I know Dr. Bhadrama. I have heard about her because Dr. Madhusudanan is the brother of Dr. Bhadrama. Is it so, Dr. Bhadrama?
No.
Okay. See, Madhusudanan.
Okay, so, madam, what is your question, Ramadevi, madam?
I know.
Amma.
See, Dr. Paul, this presentation was very nice. I want to tell you one thing. You told you are not beautiful. The beauty lies in the seer of in the eyes of those person who see you.
Okay, thank you.
Beautiful.
See,
From our eyes, you have to see.
Yeah.
So,
So
but
here
that was correct.
Yeah, here one thing I want to tell you, just I forgot the important things. When the case taking, right? The Dr. Pierce Smith always telling, Pierce Smith, I think many of you know that.
Pierce Smith.
He said, when you are case taking, while case taking, three things you have to, right? If any tears or smile or silent.
Yeah.
This three things is the turning point of the case. From that, you have to loop the case. You have to just pull the case. So that's the one.
If tear come there in the patient's eyes, means we had gone to their hearts.
Yeah, that's why. Yeah. Okay. Thank you.
It was very nice presentation, doctor. And you come again. Thank you. Have a good day. God bless you. Take care.
Next day, I'll show you the different technique, not this technique, the same technique, different technique. Okay.
Okay.
A lot of techniques you have. Okay, that is good, doctor. Anybody want to talk, Dr. Paul Joseph? Can raise your hand. Ask the doubts, opinion, suggestion, anything you can ask. Such a simple doctor. He is a simple doctor and he will answer for all our questions. What your case taking is exactly scientific, doctor.
Okay, thank you.
It's a classical case taking, classical case. Find out a rubric is very, very difficult. What you said is very correct. The patient is saying to us in their own colloquial language.
Yeah, that's very important.
Even in our Kend repertory also, the certain words are colloquial.
Colloquial.
We didn't understand what Kend means. But
so this is the very, very interesting story when I was in India in the homeopathic college, this was happened. It's a very important joke. I think every one of our batchmates, they knows that. One patient came and yeah, when I took the history, the lady said, whenever I talk with the husband, I feel pain. Whenever I talk, the same colloquial language, whenever I talk with my husband, I feel the pain.
That is
So what is that? What is that?
Medicine is, I think, in my opinion, the medicine is oxalic acid.
No. What is that? What is the actual symptom behind that?
She fears husband, I think it's so.
No. There is a language, there is a colloquial, there is a dialect in a particular village. He from that village, and whenever, again I am repeating, whenever I talk with the patient, that means in Tamil, whenever pain, pain. So most of the students and my classmates, they observe, they are examining the mouth. No, that's not a problem. Talking with the husband means sexual contact.
Okay,
Yeah.
that is
their dialect, right?
the language. That is
that's right. Most of the ladies, they used that word. So don't examine the mouth. You have to examine somewhere.
see, in Malayalam, see, for cough, it is we say chuma. But in Tamil Nadu, I think it is kora. See, likewise, the language is different and the symptom is same.
Yeah,
So,
that's right. This was happened. It's happened. Doctor.
Sir, it is the time to wind up the session, and I think we can have your third edition of the session, if possible, on March 5th, Sunday, because you prefer Sundays only.
Yes.
If there is no other engagement, we can fix it directly now, because March 5th.
Yeah, March 5th, okay.
Okay, so I invited Dr. Hariharan sir to say what of thanks to the session, and it is really an amazing session from you, sir.
Dr. Reza. Dr. Reza, please say a lot of thanks to Dr. Paul Joseph. Dr. Reza is not available.
No,
Thank you, sir. Thank you, sir. I want to ask a question from you, if you allow me, sir. A few sessions ago, you said about a remedy, genophalium in polyneuropathy. I want to know the indication of this remedy. If you
Okay, it is question is for me. Is it question is towards me, doctor?
So I think the question is to Paul Joseph, and we can.
No, I didn't talk about the genophilum, naphilum.
No, I think
no, sir, Dr. Harihan.
Okay. Doctor, see, that is the intense pain along the sciatic nerve. Numbness alternate with the pain. Frequent pain at the calls. Sometimes the chronic rheumatism is associated with that. Sometimes cramps of calls is also there. That is the symptoms of naphalium. Okay, doctor.
Please repeat, sir, if you possible.
Clinical tips. So
yes.
I elaborated the clinical tips. That's all.
That's only. So it is already.
Thank you.
Past 9. So please say a word of thanks, Doctor.
Please say.
Thank you, sir. Thank you.
Okay.
Thank you to Dr. Paul and you.
Okay, thank you, sir.
Thank you, sir. Thank you.
With that, we come to the end of the session. I invite Dr. Hariharan to moderate the Malayalam session. Today, our guest is Dr. Paul Joseph. James Paul. So there are 2 Pauls tonight for us, and that is something great. I think our president Said sir is there. Said sir want to say something just before the session. Yes, sir. Please say something so we can begin the Malayalam session with Dr. Harikaran sir.
I'm coming back from the Totanikara by dropping my son, daughter-in-law, the hostel now. Is Malayalam section or my English?